Do you wake up every morning with neck or back pain? Have you noticed more wrinkles appearing on your face? For many people, sleeping on your back tends to be advantageous. However, there are exceptions depending on symptoms and medical conditions. Today, let's break down the full picture with science. Why does back sleeping work for most people? This slide explains it all. When you sleep on your back, your spine more easily maintains its natural alignment. Body weight is distributed across a wider contact surface, reducing concentrated pressure on specific areas. Orthopedics supports this from the perspective of pressure distribution. Side sleeping and stomach sleeping tend to place uneven loads on the spine. The skin gets pressed against a pillow or arm, potentially etching in wrinkles. Neck rotation and lumbar distortion can lead to chronic pain. This is what multiple studies in sleep medicine and orthopedics show. However, the optimal posture changes depending on the type of pain and medical condition. Taking individual differences into account, let me show you the scientific evidence today. Your spine has a natural S-shaped curve. When the cervical, thoracic, and lumbar spine trace a beautiful S-curve, the load on the intervertebral discs is minimized. The question is whether your sleep position maintains that curve. When sleeping on your back, the entire spine more easily maintains its natural alignment. Body weight is distributed across the entire body surface, reducing concentrated pressure on specific areas. This is the fundamental orthopedic concept of pressure distribution. However, there is a note for people with lower back pain. For those who tend to have an excessive lumbar curve or have spinal stenosis, lying flat on your back with legs extended can sometimes worsen back pain. For such individuals, simply placing a cushion under the knees to slightly flex the hip joints can significantly reduce the burden on the lumbar spine. What about side sleeping? If the pillow height doesn't match, the torso tilts and places a load on the spine. However, many people find side sleeping comfortable when using a knee cushion and choosing the right pillow. Stomach sleeping means maintaining the cervical spine rotated 90 degrees for many hours. The load on the neck muscles and intervertebral discs is significant, making it a posture that is generally difficult to recommend. However, since there are conditions where symptoms change based on body position, anyone who is concerned should consult a healthcare provider. You may be spending time and money on skincare, but what if you're pressing your face against a pillow for 7 hours every night? When you sleep on your side, your cheek and forehead are compressed against the pillow. The skin continues to be folded for several hours. In dermatology, this is called sleep compression wrinkles. When you're young, they disappear when you wake up in the morning. However, as skin elasticity decreases with age, those creases can become more likely to set in. While individual differences exist, the risk accumulates the more you continue side sleeping. Stomach sleeping requires even more caution. The entire face is pressed against the pillow, maximizing the compressed surface area. A forehead, nose, and cheeks, everything continues to be folded for hours. When you sleep on your back, there is virtually no compression on the face. Gravity only pulls the face in the direction of the skeleton, making it less likely to create folds in the skin. Combining skincare with sleep position can create a synergistic effect. Have you ever woken up in the middle of the night with heartburn? That is deeply connected to sleep position. It's a condition called acid reflux, or GERD. Stomach contents reflux into the esophagus, causing a burning sensation. During sleep, the assistance of gravity decreases, making reflux more likely. The 2022 guidelines from the American College of Gastroenterology recommend, quote, gently tilting the entire upper body. Simply stacking pillows can increase the load on the neck and may also raise abdominal pressure. A wedge cushion, or elevating the head of the bed, tends to deliver its effect more safely. Even more effective is combining this with left side lateral positioning. When sleeping on your left side, the junction between the stomach and esophagus sits in a higher position. This structure makes it physically easier to prevent acid reflux. On the right side, the junction sits lower, creating a state where stomach acid more easily flows into the esophagus. People with GERD symptoms may see improvement by avoiding the right side. In addition, avoiding meals before bed and managing body weight are also important factors in GERD management. Here, I need to explain an important exception to back sleeping. It's obstructive sleep apnea, or OSA. When sleeping on your back, gravity pulls the base of the tongue backward. The soft palate also collapses. The airway becomes obstructed, and breathing stops. This is why back sleeping tends to be problematic for OSA patients, particularly in a type called positional OSA. Sleep apnea is significantly worsened when lying on your back. In a 2019 review in the European Respiratory Journal, cases were reported where switching to a lateral position significantly improved AHI in this type. However, the degree of improvement varies greatly among individuals. In severe OSA that is not position-dependent, positional therapy alone is insufficient. In the 2019 guidelines from the American Academy of Sleep Medicine, AASM, CPAP is the first-line treatment for moderate to severe OSA. Positional therapy can be effective as a supplementary option. However, anyone who snores, has strong daytime sleepiness, or has been told their breathing stops should consult a doctor first. OSA is also associated with cardiovascular risk, and there are limits to addressing it through self-judgment alone. Side sleeping has its own scientifically backed merits, particularly left-side lateral position. There are benefits to the digestive system. The stomach is located on the left side of the body. In left lateral position, the outlet of the stomach faces in the direction of gravity, making it easier to promote digestion. And there is the recommendation for pregnant women. The American College of Obstetricians and Gynecologists recommends the lateral position. Why? There is an anatomical reason. The abdominal aorta runs slightly to the left of the spine, while the inferior vena cava runs slightly to the right. In late pregnancy, sleeping on your back can cause the enlarged uterus to compress the inferior vena cava, potentially reducing venous return. That is why left lateral positioning is considered more preferable. However, research in the Lancet family of journals has also reported that the difference between left and right is limited. There is no problem sleeping on your right side when you are too uncomfortable to sleep otherwise. What should be avoided is lying on your back. In late pregnancy, avoid your back above all else. This is the clear message from obstetrics. Simply changing your sleep position is not enough. If your pillow doesn't fit, the effect is cut in half. There is an important premise I want you to understand first. The optimal pillow height varies greatly from person to person. The depth of the cervical spine curve, body type, and mattress sinkage, all of these have an impact. What is the standard for sleeping on your back? It is maintaining the cervical spine's natural curve in a neutral position. The back of the head sinks slightly, and the curve of the neck is firmly supported. Cervical roll-type pillows are designed to support this curve. The standard for side sleeping is a height that fills the gap created by the shoulder width. The pillow must fill the gap created between the shoulder and the head. If this gap cannot be filled, the cervical spine tilts toward the shoulder, placing a chronic load on the muscles. It cannot be stated uniformly as a specific number of centimeters. This is because if the mattress is soft, the required height changes by the amount it sinks. Mayo Clinic and Harvard Health Publishing recommend individually adjusting the height so the cervical spine is in a neutral position. Tonight, try placing your neck and head on your pillow. Check whether your neck's curve is being maintained naturally. That alone may change how you feel tomorrow morning. Now, let's organize today's key points. Here's today's summary. First, back sleeping is an advantageous position for many people, from the perspectives of pressure distribution, protection of spinal alignment, minimization of wrinkles, and reduction of GERD. However, those with excessive lumbar curve or back pain should add a cushion under the knees. Adjust your pillow individually based on the standard of a height that keeps the cervical spine in a neutral position. Rather than a uniform number, it's important to match your own body. Second, those with sleep apnea syndrome are exceptions. In positional OSA, there are cases where side sleeping significantly improves AHI. However, for moderate cases and above, standard treatments like CPAP are the first choice, and positional therapy should be used as a supplement after consulting with a physician. Avoid relying on self-judgment alone. Third, in late pregnancy, avoid your back, and left lateral positioning is recommended. Avoiding back sleeping is more important than which side you sleep on, even if you can't sleep on one particular side. Also, on the frontier of neuroscience, research exists showing that the brain's waste removal via the glymphatic system is most efficient when sleeping on your side. Understanding the trade-off, that back sleeping is advantageous for the spine and wrinkles, while side sleeping is advantageous for brain cleansing, is what scientific integrity demands. What position will you sleep in tonight? While reflecting on your own body's condition, choose the optimal position. Share your strategy in the comments section. Thanks for investing in your health today. On this channel, we explore the mechanisms of your body and the optimization of your health, not with emotion, but with evidence, not with trends, but with science. Subscribe and turn on notifications so we can continue learning the scientifically grounded truth about your body together next time. Until next time.